Now, we're also tracking growing health concerns in the United States. The Biden administration has declared monkeypox to be a public health emergency. U.S. health officials made the announcement yesterday following a spike in cases, and by doing this, it will free up more federal funding and resources to fight the virus. It'll also speed up vaccine distribution and allow health agencies to collect more data on the spread. Right now, there are more than 6,600 cases of monkeypox in the United States. Now, Julia Wong is working on this story from Washington. Julia, great to see you. What are you looking into about this public health emergency and what it actually means?
So, Hannah, it does mean a few different things, and the numbers are changing constantly. There are now more than 7,100 monkeypox cases in the U.S. That's more than anywhere else in the world. And the World Health Organization declared monkeypox a global public health emergency last month. In the last few days here in the U.S., individual states like California, New York, and Illinois, they have also declared their own state of emergencies. So the nation itself declaring a public health emergency elevates the severity of the situation here. The federal government, as you mentioned, can free up funding and resources to fight this virus. It will also be able to collect more data that they hope to be able to make decisions from different jurisdictions and then develop new strategies to distribute vaccines and treatments.
It's a very important signal to the community that all hands are on deck now with regard to monkeypox, that everybody understands that this is a very high priority.
And so, Hannah, one of the main critiques is that demand in the U.S. simply can't keep up with the supplies, demand can't keep up with the supplies. The interest in the vaccine is really outstripping what they have here in the U.S.
And Julia, there has been some criticism over how the Biden administration has handled monkeypox so far. Talk a little bit about that.
Yeah, Hannah, so there have been long wait lists in cities around the country. Some people have even gone across the Canadian border to receive their shot. So monkeypox spreads through close contact, mainly through skin-to-skin contact. And the majority of monkeypox cases happen to be in men who have sex with men, but really anyone can get it. So far, there have been no deaths from monkeypox in the U.S., but there have been deaths in other parts of the world. Now, the U.S. is looking at finding ways to stretch its current vaccine supply to meet all of that demand. So one option that's being weighed is called dose sparing, and it will give 1/5 of a full dose to each recipient. Now, the vaccine would be administered into the skin directly as opposed to into the muscle, and this would allow vaccine supply to be expanded quite a bit and get more shots into arms. Now, a decision on that from the Food and Drug Administration is expected in the coming days. Hannah.
Okay, Julia, thank you. Julia Wong reporting from Washington.